PEDO, PEDO. The magical four-letter word for and that is for some people is 10, 15, even 20 years in the making. Stay tuned as we talk to a student doctor who just matched into her top residency program for pediatric dentistry. Stay tuned. Hey, this is Dr. Darwin, new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show. We talk about getting into dental school, getting into residency, and then life as a new dentist. Guys, be sure that you stay subscribed. Also, share and comment down below. Anytime you find something that you like about the episode, put those comments down below as well. Also, this episode of Ask Dr. Darwin is being brought to you by GetIntoDentalResidency.com. Right here, GetIntoDentalResidency.com. Check it out. It's a resource for you to help you get into your top residency program this application cycle. So today we're joined with a very happy and elated fourth-year dental student who has now been getting ready to realize her dream that's been 15 years in the making and becoming a pediatric dentist. Today we're joined with student Dr. Rachel. How you doing?
I'm doing great. Hope you are as well.
Good. Well, I know not as great as you right now with all the drama and time and resource and just getting ready for this for that magical day that happened earlier this week. So before we get started, I want you to introduce yourself so everybody knows a little bit about you.
All right, perfect. So my name is Rachel Porter. I am a fourth year at East Carolina Dental School. I'm originally from Charlotte, North Carolina, and I attended Howard University for my undergraduate studies and went straight through to ECU at 21 years old. And here I am, 25, going straight through into residency. So I have been a student for over 20 years. But we got 2 more and then we'll be done with the classroom.
There you go. Well, it's an investment, right? All this time and
commitment.
Effort. It's a commitment. It's an investment. It's a dedication to get to your goal. So let's talk a little bit about your initial goal, which was to become a dentist. Why did you pick dentistry?
So when I was about 9, I got my first cavity and I was terrified. I was scared. I got online and I looked up, what do they do? Are they going to hurt me? What's going to happen at this appointment? So when I got to the appointment, I was ready. I was looking at the numbing jelly, like I know what that is. That's first. And then they're going to give me a shot. And there was something about the way that the dentist spoke to me. At that time, it was a general dentist, and he was just extremely kind of mean. At being 9, I thought he was mean, and I was kind of like scared of him. And the way he spoke to me just made me, super apprehensive. And I was very outspoken at 9 years old. So I did not let him touch me. And I went to the waiting room and I told my mom, I said, I don't feel comfortable. I don't feel like I'm safe. That was my biggest thing. So she was upset that we didn't get the procedure done because we were getting braces the next week. So it's going to delay our process a little bit, but we ended up going to a pedodontist the next week. And absolutely, she changed my whole perspective on dentistry. The assistants, the front office staff, I wanted to be there. I was happy. They had games in the lobby. And I left thinking like the way she made me feel is how it's supposed to be. So that stuck with me. So that next week I got braces. And after braces, I got my wisdom teeth pulled. And these were all people of color that were, my caretakers. So I really saw people that I could say, you know what, I can be that. I want to be that. So my ortho actually went to Howard, and she inspired me to see like, this could be me. I can do what she's doing. And I stuck it out. I went to Howard. I went in knowing what I wanted to do, studied biology. I started shadowing. I did programs in the dental field, and it just became a passion of mine. And even now as a D4, I know I chose the right profession because it aligns with my passion. And my biggest thing is that I value how people feel when they're in my chair, because I don't want to be that 9-year-old,
Right.
that feeling that I felt. I just wanted to let that never happen. And I told someone in my match interview, I said, in dentistry, in medicine, this world is about being the smartest. You know, what's your GPA, what's your grade, what's your DAT, what's your MCAT? And that dentist, when I was 9, he could have had the highest DAT score, the highest, you know, board certified, highest scores, top of his class, but I would never know his technique or his hand skills because patient management wouldn't let me get that far. And there are so many people who are not outspoken and sit in the chair and just have a fear and anxiety of what's going on, but that's not how it should be. So that feeling alone really inspired me.
Yeah, and it sounds like another great case in point of why melanin matters, right? In medicine
Yes.
and dentistry, um, just the ability to relate and see someone that looks like you and
Right.
how they handle you and help you, it just allows that experience just to really engulf you to the point where it's a great experience. And I'm sure that experience was definitely, it sounds like it was a segue to one of the reasons why pedo. So let's talk a little bit
Yes.
about that. At 9 years old, having that experience, also
Mhm.
having uh, the ability to, the experience in the office and how you felt afterwards, which was sounds like it was a totally different type of experience
Mhm.
previously. Talk a little bit more about how that experience and other things really helped to shape your direction into pediatric dentistry.
Yeah. So at the age of 9, I was already working in my church, in our nursery, like doing children's church. So I was working with children a lot. And I was an athlete in high school, and we used to go around to elementary schools and read and donate books. So working with kids came natural to me. When I was a senior in high school, I applied to be for an internship that was in a dental office, and I didn't get it. And I was super upset about that because I wanted to have some type of experience in the field before leaving for Howard, but I was actually placed at a summer camp for kindergartners. And I feel like that experience was probably just as beneficial, being able to work with kids and be in my passion for an entire summer. So when I left for Howard, it was almost a no-brainer. I came home and I shadowed in pedo offices specifically to get that experience. And it was just solidified from there. And now at ECU, they're throwing me, you know, every kid that needs nitrous at me as soon as they walk in the door. So I love it. I love being able to change the trajectory of when they come in, they're scared. When they leave, they're happy or even inspired by me. So that's what led me to pedo.
Yeah, and for many people, um, whether it's their own experience or a relative's experience, and being able to shadow and um, whether it's in dental school or in offices, looking at those experiences is something that allows them to feel like, hey, I can do this, or hey, I want to do
Right.
this, right?
Right.
So
You
that's
can't
in
be what you can't see.
there you go. There you go. So let's talk about how you went into this process, specifically the applications, because as many of us know, and as you have just gone through, it's not for the faint of heart. It is something that you have to intentionally prepare for, and it is a process. So talk a little bit about your process and how you prepared for your application.
So I started in around June with my application. So it's been about a 7-month wait and application process. I took boards in May. So after I passed boards and got that out of the way, I really dove into my application. I had already asked for my recommendation letters to be written by certain faculty members. So when June came, it was all about me putting my application into the application portal. But for me, I focused really hard on my CV, and I wanted it to be really organized. I did a lot of work with SNDA and other organizations through my dental career. I wanted to make sure that that stood out on my application because I did not have the highest class rank. I did not have, the super high GPA, but I had leadership roles. I had volunteer work. I had community involvement. And I feel like in pediatrics, as I mentioned to you before, who you are as a person is just as important as, how smart you are. So the things that I did outside of campus, I thought to be extremely beneficial in my application process. But I made my own CV. I took a lot of time with it to make sure it was organized, everything was in place. And then I pretty much copied my CV into the application portal. And from there, it's the waiting game, really.
Yeah, and for many of us, because I remember as well, that wait can seem like 4 years of dental school, right?
Yes, definitely.
Too long, too long. So let's talk about those schools and those programs and like the number of schools that you applied to and why specifically some of those programs.
Sure. Okay. So I applied to a lot of programs because of my GPA. I was a little apprehensive. So I cast a very wide net. I applied on the East Coast and the West Coast. I applied to school-based, hospital-based, or even the mixed curriculum. And I applied to realistic places. So I applied to places that I could see myself living. So I didn't apply to any programs like in Alaska or Hawaii or anything that was, too far unrealistic.
Not Hawaii, not Hawaii.
No. A little too far for me. But I applied places that I could see myself living in, thriving. I was always open to new opportunities, so I didn't limit myself, but I definitely was realistic when I was applying.
Okay. Now, when you say as far as where you see yourself living, for the 2 years of pedo or for the 2 years and beyond potentially?
So for the 2 years of pedo specifically, a lot of people tend to stay in the area that they go to residency, depending on how things work out. So I wanted to make sure that it was somewhere that aligned with, my goals and my plans of practice. Of course, I would have been happy to be anywhere because I want to be a pediatric dentist. So the training, as long as it's board certified, wherever you go, you will be a pediatric dentist. But I did want to be realistic with myself.
Yeah. And we're gonna share with everyone where you matched that as well in a minute. So guys, stay tuned. And if you're feeling, if you are getting some value from some of the stuff that you guys are listening to, please put a comment down below, and that'll help with us having some more engagement. And let's talk about the engagement that you had for your interviews, right? Because that's the next step. You do all this work with your CV, your application, the letters of recommendation, so that you can get to the next step. That next step is the interview. So let's talk about the interviews that you had, the number that you had, and then a little bit more specifically about any questions that you remember that were kind of like, ooh, I didn't think about that one, or ones that you saw that were pretty much routine as well.
So I received 5 interviews. And because I did participate in post-match, I interviewed on the spot. So I'll get into that one a little bit later. But my 5 interviews were at UNC, UAB, where I currently am, ECU, LSU, and VCU. And 3 of those were virtual and 2 were in person. And the questions that I got on the interviews were, of course, why pediatrics, why dentistry, tell us about your journey. And a lot of them are sometimes one-on-one, or sometimes you're in a group of 5 people in a conference room, or maybe even 15 people on a Zoom call. So it's very different environments wherever you are. But in my interviews, I just wanted to be myself. And I even had some program directors that were virtual say, like, we still want you to come visit if you can. Zoom, I felt like limits the application process because in an interview, there's so much value in, how you walk in the door, do you shake hands, eye contact. So being on Zoom, you lose all of that. And some people that maybe are not as prepared in that way can kind of hide that on the computer, but it changes the interview process. So faculty has to kind of see how you present behind a computer screen, which is tough.
Right.
But the only questions that shocked me was I was asked, what's something that no one would know about you just by looking at you or seeing you on social media?
Oh, that's a
What's
good one.
something,
Say that
what's
again.
something about
Repeat that one.
you that, right. So when I answered that, I spoke a little bit about my anxiety and how I've struggled with testing in the past and how I felt pressure because I feel like some people see people in dental school and they think, oh, they have it all together, or oh, they made it, so they don't really have any struggles. And I feel like that's so not true. So I talked about my journey and how I've overcome a lot to get to where I am. I also had some questions about how would your classmates describe you? If you were put into a group, would they want to work with you? I have heard some pediatric residency faculty, they will ask you to sing and dance because they want to see how you are with children. So, I've known some people to have sing the song from Frozen, Let It Go, and, different little songs and dances that the kids are doing now. I've had patients in my chair that have pulled up TikTok videos and have said, can you do this? So the times are definitely changing, but it's allows me to feel like a kid again when I'm told to sing and dance because I love, Disney Channel and having different things to relate to children because I just feel like I'm not that far away from being a kid and it just makes me stay young. So talking about different things that makes you relate to children is super important. I didn't really get that many questions about my class rank and my GPA because they wanted to get to know me. They didn't really care about, my test scores or anything like that because when you're a pedodontist, who you are as a person and your character, as I said before, is really important because you have to relate to a child.
Yep. And that child and the family don't know if you number one in the class or if you number 101.
Right. They
It
just
does
care about the safety of their child in your hands.
exactly, and how you treat them, how you communicate with them, how you relate to them, all of that.
Mhm.
How you did the TikTok dance and video, you
Right.
know, all of that,
Right.
all the things
But
that.
I also think with interviewing, it's good to get a good relationship with the people that you interview with.
Mhm.
I definitely believe in sending thank you emails or personal handwritten thank you notes, updating them on things that are happening in your application process.
Right.
Because if it had not been for the relationships that I built during my interviews, I would not have been able to post match because those were the people that were advocating for me because the match may not work in your favor or in the program's favor. Match is like a behind the scenes underground process of matching you to a residency. So you have to know people and value relationships in this process as well.
Yeah, and I'm glad you brought that up about the process because a lot of people um, are remiss about a situation that can happen and happens every year, not just for the candidate, but also happens for the program, which is you may not particularly match with somebody on your list, but then some programs don't fill all of their positions, don't match all their
Mhm.
positions. Happens all the time. It's just part of the process. However, if you're not prepared and ready and know what to expect as that part of the process comes up, you can miss out on an opportunity to become pediatric dentist, to be an oral surgeon, to be or an
Yeah.
orthodontist as well. So I think it's important to note that it is a process, and part of that process is the post match, right? This is the period of time where you have some candidates, right, and you have some programs that weren't successful in the first part of the first step of the match, and now everybody, programs and candidates, are on the second part of the match, which is called post match, after match, and it starts
Mhm.
on 12 o'clock on match day, and it could end at 1 o'clock, or
Yep.
it could end 1 week later, depending on the program and the candidate. So if you would just share a little bit about how you handled that second part of match, because I think it's important for people to understand that it's all part of the overall process.
Right. And I'll talk a little bit about my rank list and my order as well. So I ranked all 5 of the schools that I interviewed at, and I ranked based on where I truly felt that I would be happy. I wanted to go to a program that I'm excited to walk into the door, and the next day I'm excited to do the same. So that was important for me. I wanted a positive working environment. I want to work with residents who trust their faculty members that value their residents. They don't talk down to them or belittle them, but there's a healthy relationship between the faculty and the residents. That is super important to me. Of course, funding, living arrangements are another different aspect. Stipend, all of that is important, but I was very, very critical on ranking based on my happiness and thriving in a certain environment. So when I had a number 1, and that number 1 school, I went back for a second site visit because the interview was virtual. So I went, one morning, I was free. I did a sedation case with the resident, and I had a great experience, and I left thinking I would be happy here. So I didn't have to go, but I went because I wanted to. And that was very important now looking back, because on match day, everyone expects to match. I think everyone has a little fear they may not match, but when I opened the email and I didn't have a match, I was stunned. I was stunned. I was upset. I felt like, maybe pedo is not for me, maybe next year. And my biggest fear was that I would have to do the whole application process again. And I did not want that.
And let me just say something about that, because it's important for you, for us to demonstrate and share the fact that if you don't match, it just means not a match right now, and it just means not a match right now with those 5 programs or those 6 programs. It does not mean that you don't have the qualifications to become a pediatric dentist or oral surgeon or orthodontist. That's all that means. So those that are watching and listening, get rid of that imposter syndrome type of thinking that, oh my God, I didn't match. I'm not qualified. I'm not good. No, it just means you didn't match at those programs that you applied to at this particular time. That's all that means. That's all that means. And because, as you have demonstrated and are sharing, you continued the process and you did match at a different program. So that's all that means. So you guys that are listening, please understand that. Like, don't be introverted into yourself. Like, oh my God, woe is me. I'm not good. I'm bad. No, it just means that you did not match with those programs. Does not mean that you will not match at any programs. So I just wanted to share that as a word of encouragement, but also as part of your mindset as you're thinking and going through this process from the beginning all the way to the end to where you are right now. So
And so I definitely, when I saw that email, it was a struggle just in that moment, but I immediately had to get out of that and start getting on my computer and making connections. So I emailed every single director I interviewed with, and I thanked them for, one, seeing something in me to interview me, and for their support along the journey. And a lot of them responded back to me, and they were stunned as well. They didn't receive the candidates that they thought they were going to get as well. And that program, that was my number 1, she said to me, you need to be a pediatric dentist. And she said, send me over the list of the schools with empty seats. Send it over to me right now. We were on the phone. I sent it over to her, and she said, I'm about to start calling right now. She said, you're sending your application right now. And of course, I had already that morning got on my computer and reached out to directors with open seats. So I did my part. I was just waiting.
Yeah.
And she picked up the phone and she called me, and we she started reaching out to people, and one specific person at Boston University where I'm going, she knew her. And it was about 6 p.m. 6 p.m. She shot her an email. This is on match day. And she said to me, Rachel, you could have been sitting in your room crying all day, but you are doing what you're supposed to do, which is still participate in post-match, because you still need to be a pediatric dentist. And I had other program directors that I interviewed at emailing me back saying, let us know what you need, let us know how we can help. And of course, in my mind, I'm like, I would have loved for you to rank me higher, or, I would have loved for you to match with me. But
I got one thing I can tell you right now.
Right. But about 2 hours later, Boston University's program director reached out to me via email and said, we can Zoom tomorrow at 12. We have one seat. We're interviewing for it. And I was ready. And I had a graduation requirement that I was challenging the next day in clinic. I had to stomach that and then push through the interview. And 20 minutes into the interview, she said, we would love to have you. You're a great fit for our program. Would you like our final seat? And on the interview, she said to me, Rachel, the match process is a process that we can't really define, but everything happens for a reason. Just like you, it didn't turn out how we expected, but Here we are. And, this is how it's supposed to be. And that's how we have to move forward. So yes, my process was a little bit more anxiety driven and a little bit more stressful because I did have expectations to match that morning. But by the next day, I was already in another program, and I'll still be able to live out the dreams and the plans that I had for myself.
That is awesome. That's a great testimony and exemplary of why networking is important. Why getting a no just means no right now, and that you got to still push through. And then the third thing is exemplary of why you must see it through, right?
Yeah.
When you're up against the trouble, meet it squarely, face to face. If you guys haven't heard, I've
heard it.
I know you have.
Finish.
I know
Head
you
high
have.
to the finish.
That's right. I know you have. I saw that pin on your shirt there. So I know you have. But for those of you that haven't, Google that poem, see it through. And that's what you did.
And I want to say, I did have people that I met in interviews that were in the process for the second or third time. They would say, we would have mixers and socials, and they would say, I interviewed with 7 people last time. I didn't match anywhere, so I'm trying again. So it's one of those things where there are people that have applied to PEDO and don't even interview their first time.
Right. Or the second time.
You're competing for programs that have 3 and 4 seats out of people that are extremely qualified, because even in dental school is already the cream of the crop. It's everybody you're in a room of people that are, on that next level. So the question is, how do you stand out in a room full of standouts?
Yeah. And that's a great segue to the next question, which is advice for future applicants, right? We already set it up. You guys, have to have the mindset of no just means no right now with those programs. Doesn't mean no forever. You have to see it through, right? And especially since post-match is still part of the process. But knowing what you know now and the things that you've gone through with this process, what advice would you give, say, your little sister who wants to be is going to follow in your footsteps and wants to be a pediatric dentist, or, one of your little sibs at ECU that, that's maybe a D2 or D3 that wants to do pedo as well. What advice would you give them, knowing what you know now?
My advice was, while striving to be, a great dental student, also strive to be a good person. Make yourself well-rounded. Don't just be someone who goes to school and goes home. Be someone who wants to volunteer, work in the community, and build your resume. Your resume is going to carry you through. They don't want to see someone that just has high grades and no community involvement. I would advise that they also be prepared to deal with some adversity, have some grit, have some discipline, because there are going to be times where we thought the DAT was going to be our hardest obstacle. We thought that boards was going to be the hardest thing. And here we are trying to get into the residency, and it's the same struggles that I had before, and everyone's story will be different. So definitely don't compare yourself to others. I was interviewing for Match in September, and some people didn't start interviewing until November. So it just depends on your process. Trust your own process and try your best to understand the match, even though I feel like no one has mastered that. Try to gauge, understand what you're dealing with, be prepared to post match. I even thought for a second, maybe I'll do a GPR, while I'm trying again, because since pedo is in phase 2 of match, people that did not match in ortho or perio in November, they're also in phase 2, with us trying to get an AGD and GPR program. So it's just as competitive, but I did start reaching out to some GPRs as well, because we had to think in the future, in the moment. Yep. So just keep going, don't stop, have a plan, stick to it. And please ask for help. Please ask for help. Reach out to people who are, new in pedo or have been in pedo for years. But find a good mentor, find a good group of people that have the same dreams and passion as you do, so you can ensure that you're going in the right direction.
Yeah, that asking for help is big, and it's a quote that I always love, always like to share, which is the smartest student, person, dentist in the room is that one that asks for help. Everybody needs help at some point in your career. You don't know everything, right? You haven't experienced everything, but if you have a good network of friends and colleagues, that's what they're there for, to help. And you will help them when you share your testimony, you share your experience, just like you're sharing everything today. And you share those great pearls of advice as well. What's the best way for people to get in contact with you if they have any other questions about your journey and what's going to be happening with you in a couple months when you start in July for pedo? What's the best way to contact you?
So my email is probably the best, but I also am on Instagram a lot. I'm not one of those people that's going to ignore your DM, I promise. So please feel free to shoot me a DM if that's, something that you are doing on Instagram, but I always respond. I may provide my cell phone after that if we want to talk, one-on-one. I'm always open to that, but I always believe in being a good mentor because I had good mentors. So I would never, not take someone on to help them, but email or DM would be great.
And again, her Instagram is right here. You want to shout it out so people can hear it who are listening?
So my Instagram is at DrRachel. So DrRachp.
There you go. Well, Dr. Rachel, we are so happy, so excited. We know you've been building your resume, your CV with all the different leadership activities. You're currently vice president, national vice president, right? SNDA?
So I actually passed down the reins. I'm immediate past now.
Immediate past. But you still had that responsibility and duty that you fulfilled. So that's great. And that, again, like you said, all part of the process of getting into pedo, which you did. And you're going to Boston, right?
University.
Boston University.
BU.
BU, there we go. Well, BU is going to be very excited to have you. Just like the program director told you, 20 minutes into the interview, she probably was like, "Oh, come on, you gotta come on. We gotta have you. So congratulations and thanks so much for sharing your time, guys. Make sure you check out these next videos right here. Hopefully they will help you as well. And that's our time. Love, peace, and smiles. We'll see you next week. Next video. See you next week.
Thank you.